If you're vaccinated, you're not going to be hospitalized, you're not going to be in an ICU unit, and you're not going to die. If you've been fully vaccinated, you no longer need to wear a mask. Let me repeat, if you are fully vaccinated, you no longer need to wear a mask. If you're vaccinated, you shouldn't wear a mask. If you aren't vaccinated, you should be wearing a mask. You're okay. You're not going to get COVID if you have these vaccinations.
Yeah.
The vaccines are effective. They're effective against the variants currently circulating in the United States. Earlier today, our medical experts announced a plan for booster shots to every fully vaccinated American. The plan is for every adult to get a booster shot 8 months after you got your second shot.
We can kind of almost see the end. We're vaccinating so very fast. Our data from the CDC today suggests, that vaccinated people do not carry the virus, don't get sick.
Our vaccines work. Right now, they are working, and they require actually 2 doses or to be fully vaccinated to work well. So I would encourage all Americans, get your first shot, and when you're due for your second, get your second shot, and you'll be protected against this Delta variant.
Reports from our international colleagues, including Israel, suggest increased risk of severe disease amongst those vaccinated early. Given this body of evidence, we are concerned that the current strong protection against severe infection, hospitalization, and death could decrease in the months ahead, especially among those who are at higher risk or who were vaccinated earlier during the phases of our vaccination rollout.
Our vaccines are working exceptionally well. They continue to work well for Delta with regard to severe illness and death. They prevent it. But what they can't do anymore is prevent transmission. So if you're going home to somebody who has not been vaccinated, to somebody who can't get vaccinated, somebody who might be immunosuppressed or a little bit frail, somebody who has comorbidities that put them at high risk, I would suggest you wear a mask in public indoor settings.
Especially data that our authorized vaccines are effective against the variants that are circulating in this country. Finally, we know that in the rare event that people get infected after a vaccine, the resulting infection is more likely to have a lower viral load, be shorter in duration, and likely less risky of transmission to others. Considering all of these factors, the data on vaccine effectiveness, the science on their ability to protect against circulating variants, and our growing understanding of the low risk of transmission to others, combined with universal access to vaccines for those 12 and older, today, CDC is updating our guidance for fully vaccinated people. Anyone who is fully vaccinated can participate in indoor and outdoor activities, large or small, without wearing a mask or physical distancing. If you are fully vaccinated, you can start doing the things that you had stopped doing because of the pandemic. We have all longed for this moment when we can get back to some sense of normalcy. Based on the continuing downward trajectory of cases, the scientific data on the performance of our vaccines, and our understanding of how the virus spreads, that moment has come for those who are fully vaccinated.
Do you anticipate it getting even worse in the winter weather?
Yes, the amount of time you spend indoors, the fact that as it's colder, your upper respiratory tract doesn't do a good job of suppressing the virus. So your that seasonal transmission level is pretty clear in the data. And we'll be able to get up to the 70% plus that we need, even if the vaccine's very effective, to block the kind of exponential growth in transmission and put it into an exponential decline. During 2021, we should be able to manufacture a lot of vaccines, and that vaccine, key goal is to stop the transmission, to get the immunity levels up so that you get almost no infection going on whatsoever. These vaccines will allow us to save millions of lives. They'll also have another enormous benefit. They'll allow us to develop a plan for the world to globally eliminate COVID-19. As it is, we only have to get up to probably 70%
of people inoculated.
Yeah, with the being treated with the vaccine to drop the numbers down dramatically. Everyone who takes the vaccine is not just protecting themselves, but reducing their transmission to other people and allowing society to get back to normal, we will be able to get to the majority of the population to get to a level where the transmission slows down very dramatically. Certainly by summer, we'll be demand limited, and we should get we can convince people to trust the vaccine. We'll get to a level where our fall will be pretty normal. You know, we didn't have vaccines that block transmission. We got vaccines that help you with your health, but they only slightly reduce the transmissions. We need a new way of doing the vaccine.
70, 75%. It's a range. The range is going to be somewhere between 70 and 85%. The reason I first started saying 70, 75, I brought it up to 85. That's not a big leap to go from 75 to 85.
By the time you get to the mid to the end of the second quarter of 2021, namely May, June, July, August, you very likely could have overwhelming majority of the people vaccinated, which means you'd have herd immunity.
Herd immunity is that when you have enough people who've either been infected and or vaccinated and protected, that there's enough protection in the community that the virus doesn't have the capability of freely being transmitted from an individual to individual. You kind of have the herd protection as an umbrella. We're not there yet. That's not a fundamental strategy that we're using.
That would allow you to safely get people back to school in the fall, to safely get people back to the kinds of works that would otherwise be difficult as you get to the middle and end of the summer. So it's going to start in April, and it's going to go right through the end of the second quarter of 2021. These vaccines work well against this virus, including the Delta variant.
They're really quite impressive. I mean, a 94.5% efficacy. Certainly breakthrough infections. Breakthrough infections mean you have been vaccinated, but you still get infected. But the critical point is that I think 7 out of 8 or 8 out of 9 of them had no symptoms at all, which means it is very likely that the level of virus in their nasopharynx is low and they won't transmit it. When people are vaccinated, they can feel safe that they are not going to get infected, whether they're outdoors or indoors. That's the bottom line of that, to get people to appreciate you get vaccinated and you're really quite safe from getting infected. Even if you do get a breakthrough infection when you're vaccinated, the chances of your transmitting it to someone else is exceedingly low. If you do get infected, the chances are that you're going to be without symptoms, and the chances are very likely that you'll not be able to transmit it to other people. The fact that we know now that these vaccines are highly, highly effective, they're really, really good against variants.
So the issue with a person who is vaccinated, who gets infected, the level of virus in the nasopharynx of that person is relatively equivalent to that of an unvaccinated person, which means there's a mechanism to say that that person very well might be able to transmit it. And in fact, we have documented cases where a vaccinated infected person did transmit. The level of virus in the nasopharynx of a person who's vaccinated and infected is the same level as the level of virus in the nasopharynx of an unvaccinated person. So you can make a reasonable assumption that they can be equivalent in how they transmit. We are seeing that the ability of individuals who are infected through breakthrough infections, namely vaccinated people who ultimately get infected, that they are generally without symptoms or minimally symptomatic. However, it is clear that they are capable of transmitting the infection to uninfected individuals. And the data that they reported indicates that if you look at the level of virus in the nasopharynx of a person who's vaccinated and has a breakthrough infection and compare that to the level of virus in the nasopharynx of an unvaccinated person who's infected, they're essentially equivalent, which would go along and underscore the fact that vaccinated people who do have a breakthrough infection are clearly capable of transmitting the infection to an uninfected person. We're starting to see waning immunity against infection and waning immunity in the beginning aspect against hospitalization. And if you look at Israel, which has always been a month to a month and a half ahead of us in the dynamics of the outbreak, in their vaccine response, and in every other element of the outbreak, they are seeing a waning of immunity, not only against infection, but against hospitalizations and to some extent death, which is starting to now involve all age groups. It isn't just the elderly. So if one looks back at this, one can say, do you know, it isn't as if a booster is a bonus, but a booster might actually be an essential part of the primary regimen that people should have.